Bismillahirrahmanirrahim. Today I would like to share the knowledge about Histomonas. My name is Sarfraz Rahman. I am a PhD scholar in the Department of Parasitology. I would like to share the knowledge with references the Veterinary Parasitology second edition by G.M. Urquhart, Veterinary Parasitology fourth edition by M.A. Taylor, George's Parasitology for Veterinarians 10th edition by D. White, D. Bowman, and last one is the internet sources. Please subscribe my channel and also push the button of bell icon. The class Mastigophora, it has the most important six genera. Mastigophora, the Trypanosoma, first one is, and second one is the Leishmania, Trichomonas, Histomonas, Hexameta, Giardia. So the Histomonas, it is a microscopic pleomorphic protozoan, and it exists in two forms. Uh, First one is amoeboid form, other is the flagellated form. And amoeboid form within it is occurs. It is present in within the tissues, and 8 to 15 diameter micrometer in diameter, and in case of the flagellated, it is present in the lumen or in free contents of the cecum, and it has 30 micrometer in diameter, and histomonad having no mitochondria. It is very important that it has no mitochondria, but it produces energy that is inside the heterogenosomes. Heterachus gallinarum, called the cecal worms, the histomonas within the eggs, and it remains infectious up to 3 years. Histomonas, the final host, young turkeys, especially pullets, and site the cecal mucosa and liver parenchyma, and species Histomonas meleagritis, and it causes the disease in young turkeys or chickens, and the disease is named as the infectious enterohepatitis or histomoniosis, or it is also called the blackhead disease, and the cecum and liver infected with this disease. So the transport host is the adults and egg of the poultry ascarids, named as the Heterachus gallinarum. The life cycle, it is very important, and it is little bit complicated. The incubation period is 15 to 20 days, and the birds are mostly infected with this histomonas, and the embryonated eggs of the Heterachus gallinarum, and earthworm having the larvae of Heterachus gallinarum, and that eaten by the birds, and that will goes into the intestine, and then it causes the ulceration and necrosis in the cecal mucosa, and ultimately reach in the liver parenchyma and causes the necrosis feci. So the infected stage is the Histomonas trophozoites, and it is important point that Heterachus worms infected with the Histomonas is the in cecum by ingestion of the Histomonas trophozoites, and reach to the ovary of the worm and incorporated with the Heterachus eggs, and finally reach outside of the body. So pathogenesis, it is also called the blackhead disease. When cyanosis of head and petal is occurred, then it is called the blackhead disease. So it is extensive and severe necrosis. Tissues of the mucosa and submucosa of the cecum and parenchyma of the liver, and sometimes symptoms appears within 7 to 12 days, or clinical signs, the symptoms within the 7 to 12 days. pullets become dull, feathers are ruffled, feces and the diarrhea. It is very important sign that is a sulfur yellowish in color, and depression, reduce the appetite, poor growth, increased thirst, listlessness, drooping wings, and unkempt feathers, highly fatal for turkeys, less damage in chicken. So epidemiology, the effective risk factors, histomoniosis is the temporary host, susceptible host, and cloacal transmission. So the diagnosis, examination of the cecal contents. First you observe with the help of microscopy, and histopathological examination like the liver lesions, differentiate from tuberculosis, leukosis, avian trichomoniasis, mycosis, and then the PCR, and then similarly the necropsy and fresh or preserved carcass. The treatment, the dimetridazole 25 milligram for 1 kg body weight of the feed given in the form of the feed orally, and 2000 milligram per liter in the drinking water, and its mode of action is to damage the DNA, and then you can also use the nitrothiazole, N-heptane, N-T-2-amino 5 nitrothiazole, and to 10 gram per birds in feed, and nithiazide 1 ethyl 3 and 5 nitro 2 thiazolyl urea, and this you can give the 100 gram CQ over kg on day 0, whereas 5 milligrams on day first. So the control, the turkeys are reared on ground, wire floors raised above the ground, continuous low level medication, good management of farm and sanitation, and turkeys not raised with other galliforms like chickens. Okay, thank you so much.